Member from Frimley.
Thank you, Mr. Speaker. Mr. Speaker, in the NWT, a number of healthcare professions are regulated under the Health and Social Services Professions Act. Psychologists were regulated under this act in 2022, for example. Meanwhile, counseling and psychotherapy are not yet a regulated profession in the NWT, and I have been approached by practitioners with concerns about the lack of a regulatory body for these professions here. Anyone in the NWT can currently offer counseling or psychotherapy services without any formal education or training, as long as they are not claiming to be a psychologist or social worker. Trained counseling therapists may register with the Canadian Counseling and Psychotherapy Association, but registration with the CCPA is not mandatory, it's voluntary. This is potentially a significant issue with severe impacts on public safety, Mr. Speaker. Regulation protects the public. A regulatory body ensures that practitioners are held to high standards, promoting safe, ethical, and evidence-based practices. When harm does occur currently, there is no avenue to report someone for unethical or dangerous care if they are not a voluntary association or regulatory body member. Unregulated, untrained individuals providing counseling care may worsen things for those already in crisis. Harm can occur due to negligence, malpractice, ethical violations, or incompetence. Regulation helps mitigate these risks by ensuring that only qualified professionals provide care and that harmful practices are addressed. We expect registered nurses and physicians to maintain up-to-date licensing, ensuring their ability to provide safe care. Why should we not hold mental health professions to the same standards? Or similar standards, Mr. Speaker. I want to highlight that valuable education and training are not limited to colonial systems, and it is crucial that any regulatory framework developed for the NWT takes this into account. Currently, the College of Registered Psychotherapists of Ontario has a policy titled the Indigenous Pathway Policy, which aims to support the registration of appropriately qualified Indigenous practitioners of psychotherapy through consultation and collaboration with Indigenous communities. The CRPO also recognizes that knowledge keepers, elders, and practitioners of Indigenous traditional healing practices can provide supervision to registrants, recognizing that supervision from... Sorry, Mr. Speaker, I request unanimous consent to conclude my statement. Thank you.
Member from Frame Lake. Member from Frame Lake is seeking unanimous consent to conclude his statement. Seeing no nays, you may conclude your statement.
Thank you, Mr. Speaker, and thank you, colleagues. Mr. Speaker, the CRPO also recognizes that knowledge keepers, elders, and practitioners of Indigenous traditional healing practices can provide supervision to registrants, recognizing that supervision from non-colonial educated and trained individuals has value. Similar policies would be essential if regulation were achieved in the Northwest Territories. Thank you, Mr. Speaker, and I'll have questions for the Minister of Health and Social Services.